Hello there. Yes, this is the examination room. Yes. Please, come on in and take a seat right in front of me, okay? Yes, right on the end of the exam table. Yeah. It is a pleasure to meet you. My name is Dr. Luna. And if I'm not mistaken, are you here for the late night detailed cranial nerve examination? Yeah, that's what I thought here. So I have you scheduled. And just to double check, could I get your first and last name? Yes. Good. And a couple of questions before we begin. Some may be a bit personal, so if you don't want to respond, you don't have to, okay? Your safety is number one, and so is your comfortability. I want you to feel safe and comfortable. So, the first question is, how are you? Okay. And how are you today? Okay. That's okay. It's also okay to not be okay. And we're here for you. Good. So, putting that in. Now, some general health questions. I'm going to just get a bit close to take a quick look at you. Do you have any problems with your vision? Do you wear contacts or glasses? Okay. And do you have any problems with your ears? Hearing problems? And looking from back here, you seem absolutely and 100% beautiful. Now, we're going to begin the exam now. Is that okay with you? I'm going to get my gloves on for sanitary purposes, okay? Now, have you been sick within the past 2 weeks? This includes perhaps a cold, or perhaps you had a fever or upset stomach. Okay. And have you recently experienced any trauma? This can be from anything. This morning, I hit my head on the car door as I was coming on in. So, no need to be embarrassed. We all do something sometimes. Okay? Okay. The first thing I'd like to begin with is just getting a bit up close to you. Is that okay? Good. And I don't like to be too loud when I'm right in front of someone. I'm going to whisper, okay? And I'm going to ask you, may I touch your face, scalp, and ears? Okay. I'm just going to be feeling your face for any muscular problems, okay? Okay. So, I'm going to begin and now your scalp. Okay, thank you. It's just an overall first step. It's to also carefully introduce you to what we're going to be doing today. Now, have you ever had a finger monitor applied to you before? It's to check heart rate and blood pressure. I'm going to apply one onto you today. And we keep these on for the entirety of the detailed cranial nerve exam, okay? And it looks similar to a cast, but it has a screen on the other side, okay? So, may I place this on your finger? Thank you. Just going to apply this right to okay. And I'm going to quickly check the heart rate, your resting heart rate, while also looking, and it looks to be fine. Is the finger monitor a bit too tight? No, that's good. Next, I'm going to quickly check your temperature, if that's okay. Now, the finger monitor also checks temperature, but we always double check. So, if you could please open your mouth. Just going to quickly check your temperature. Just say, ah, good. I just want you to breathe. You can close your mouth as well. Good. And perfect. And I'm going to check the finger monitor. If you could give me your hand. Good. And they match. Perfect. Now the finger monitor is going to send me results throughout the entirety of the exam, and we'll send you those as well. So, the first thing we're going to check out is your eyes, okay? Yeah. We're going to check for something called light sensitivity. Okay. This here is a pen light. What I'm going to do is carefully examine your eyes, okay? So, first, for the sensitivity exam, I want you to let me know when the light is at its brightest, okay? I'm going to first show you the lights, and then I want you, the second time around, to tell me where it is brightest. Okay? So just let me know where the light is brightest. The first round is just to see, and then the second is to let me know. Okay? Watch the light carefully. Good. Did you catch that? Good. Now, carefully watch the pen light again, and let me know when the light is at its brightest. Okay, here we go. Right there. Very good. And now we're going to check each eye for the same thing, okay? But this time, isolation. This means we're going to test each of your eyes for light sensitivity. And sometimes your eyes aren't the same. So, I'm going to cover one eye if that's okay with you. Good. I'm going to shine the light once, and and then you let me know when it's its brightest, okay? Good. So here's the first coat. And here's the second around. Let me know when it's its brightest. Right there. Perfect. I'm going to take a quick look. Could you follow my finger? Okay. Quickly, how many fingers am I holding up? And now. And now. Okay. Are you experiencing any vertigo, dizziness, instability? Okay. Don't worry. Other eye, okay? I'm going to cover one eye. You okay? Good. Now the first time around, just look for the brightest part, and the second time around, let me know where it's at. Here we go. Okay. Did you catch that? Good. And the second time around. Very good. Right there. Perfect. Now I'm going to get a bit up close again. I'm going to shine the light carefully between your eyes. And what I want you to do is focus on my nose or my eyes. I'm looking for pupil dilation. Okay. So I'm going to get a bit up close. Follow my eyes or my nose. Just look at them. Just going to be testing for different types of light sensitivity towards your eyes and dilation, okay? And taking a look. Very good. Focus on me. Right to the center. Very good. Now, I'm going to ask you to do something that for some is a bit difficult, but it's called a focus exam. I'm going to ask you to try your best to focus on the light, okay? I'm going to take the light and move it all around your visual field, and you just follow it with your eyes. But try not to move your head, chin, or neck to keep up with the light. Just follow with your eyes, okay? Good. I'm going to ask you just to keep your chin and neck from moving. Just follow with your eyes, okay? We'll begin right here. Are you ready? Let's begin. Good. Good. Focus on the light. Good. 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 Great. Good. Very good. And below. Good. Great. Good. Good. Now, look at me. Great. Now, if you could follow your eyes on my finger, I'm going to get close to your nose. Just follow your eyes with my finger, okay? Full attention on my finger. Follow, follow, follow. Good. 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 I'm going to touch your nose. going to do something called a peripheral vision test. It is to check your peripherals. I'm going to quickly send the pen light down. And I want you to let me know when you can see my hands getting into your peripheral vision, okay? So, do not look at my hands, look into my eyes, but let me know when you are able to see my hands in your peripheral vision, okay? I'm going to start with this side, onto your left, focus, and let me know the moment you see my hand visually there in your peripheral vision, okay? Just keep looking at me. Let's begin. Good. 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 Please keep your chin straight. Thank you. Good. Good. Now with your right side, keep your chin straight. Thank you. Good. Good. Very good. Good. Very good. Very good. Now, quick show of numbers. While you're looking into my eyes, let me know which number I hold up. Okay? So, let's begin. Good. 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 Great. Good. 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 Both of them. Very good. Now, I'm going to do something which is called the comparison. I'm going to put my hands up, and I want you to let me know if my hands are equal distance away from you or a different distance away from you. And I want you to let me know which hand is closer to you, my left hand or my right hand. Okay? So, a quick example is, I'm going to put my hands up, and if my right hand was a bit closer to you, just say your left or your right side. Makes it easier. You let me know. So, in this case, which side is a bit closer? Okay. And this is even. So let's begin. Just let me know which side is a bit closer. We're going to start off with them being even, okay? So, are you able to tell that my hands are an even distance away from you? Good. Now you let me know which is closer, my left or my right side. Very good. And let's begin. Good. Good. They're even, very good. 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 Even, closer. Very good. Good. Very good. 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 Now, let's test the side. It's going to start off even. Just with your peripheral vision. Let's begin. Perfect. Good. Good. So you were able to tell. That's very good. I'm going to quickly write that down. Next, I'm going to pull out a Snellen's chart. Okay? There are two different versions of Snellen's charts. The first one we're going to go over is the one I typically prefer. It's a directional Snellen's chart. Yeah, so. So, if you can tell, a directional Snellen's chart is based solely off of the direction of the letter. Okay? I'm going to point at each, and I want you to let me know which direction the E is facing. The options are left, right, up, and down. Okay? So just repeat after me. I'm going to point to ones from right here, about a meter away, and you let me know if the E is facing left, right, up, or down based off of the entrance of the E. Okay? Good. So, good. Okay. Good. 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 Great. Good. Good. Great. Now, are the lines below this visible still, or are they a bit blurry? Okay. We're going to try then. Are you able to see this one? Okay. And here. Okay. This. Okay. That. And that. Okay. And any visibility below that, or do they get a bit blurry? A little bit. If you could try, what line do you think this one could be? Okay. Okay. That. Okay. What about that? Okay. That. That. What about that? Okay. So, well, we have two different colors on this paper. Are you able to identify the color that is this line? Okay, no, it's okay. I have a difficulty identifying colors. I'm unable to tell the difference between red and orange, and light pinks and purples. It's not uncommon. And are you able to identify this color? Okay. So this one is actually supposed to be green, and this one is supposed to be red. You did amazing. Now, from a meter away, we also have a Snellen's chart, okay? And same idea as the directional Snellen's chart. But I point to a letter and you let me know if you're able to identify the letter, okay? Good. So, I'm gonna begin. What letter is this? Good. And that. Good. This. What about that? This. And that. Good. What about this one? What about that one? What about this? And what about this? Good. Are any of the letters getting blurry below this line? Somewhere down at the bottom. Okay. Are you able to identify this letter and what is it? Okay. And this? What about this? This? That? And that? Okay. And how are the letters doing below? You could identify 1 to 2 more lines. Okay. What about this one? And next to it? That? That? That one? And what about this one at the very end? Very good. Any chance you could try to do the letters below? You could? Okay. I'm gonna point to a random one. What is that? An O? Good. And what about this? It's a T. Let's try the lowest line. Can you tell me what this one is? It's a bit difficult, but it is also a T. You did great. I'm going to do a quick up-close exam though now, because I'm looking for eye strain or your eyes to be fluctuating. Now, sometimes people do come in here for vertigo. And what that is, it's an imbalance. It can be caused by many things. And sometimes putting too much strain on your eyes or looking at small letters can cause it as well. It's also common when you have bumped your head a little bit, or even, and this is the tricky part about it, if you've fallen asleep strange on a couch, or if it's a bit too uncomfortable. So, I'm going to quickly test to see if you're experiencing vertigo. It can be a bit uncomfortable, but I'm going to ask you to close your eyes, and I'm going to put a light pressure on your eyes, okay? It's also considered to be a bit like a orbital eye exam, except I am just checking around your eyes, okay? Good. So, close your eyes. Good. I'm just going to carefully put pressure on your eyes, okay? Just relax a little bit. Just going to put pressure right on the eyes now, okay? And some people find this very relaxing. Kind of like a massage for the eyes. And you can also take this time to just think and breathe. Okay, and now I'm going to let go of your eyes. Okay? And could you let me know, are you feeling any imbalance? Okay. Are you feeling any dizziness? Okay. And most importantly, do you feel as if the world is spinning? Okay, good. The last thing we want is for you to feel dizziness. Now, I'm going to test your neck out a little bit for vertigo. Is that okay? So, sometimes just turning your neck different directions is a very good exam to test to see if even the slight bit of strain can cause it, okay? What I'm going to do is carefully tilt your head either direction. Like that. And you let me know if it feels uncomfortable at all, okay? Good. So, I'm going to place my hands right here very carefully. We're going to tilt your face different directions, okay? And you let me know if it feels uncomfortable at all. Let's begin. Okay. And keep your head here. I'm going to hold. But are you uncomfortable having your head at this angle? Quick eye exam. How many fingers am I holding up? Good. 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 Quickly follow my finger. Good. Good. Now, I'm going to get a bit close now. Just look at your eyes to see if there's any wavering, and I see nothing, which is good. Gonna move your neck back to the center and then move it the other direction, okay? So just going to carefully okay. And I'm going to look into your eyes for any wavering now that we've put you back to your original position. Okay, relax. Here, relax. And look at me again. Okay. Now we're going to tilt your head to the opposite direction, okay? Are you feeling okay? Good. So, let's get ready. Okay. And is that uncomfortable for you at all? Okay. Okay. Now I'm going to check your vision. You let me know how many fingers I'm holding up, okay? Good. 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 And follow my finger. Okay. Good. Very good. Good. I'm going to quickly look up close for any instability with your eyes. I do apologize if I keep getting close to you, but it's to just specifically look for details that could cause imbalance. Okay. And if you're okay, I'm going to put your head back to the center, okay? Good. Okay. And any difficulty with your vision, follow my finger. Good. Good. I'm gonna get a bit up close just to take a look at your orbitals. Okay. I'm seeing no problems there. Very good. I'm gonna quickly write this down. You did very good. Are you feeling okay? Good. We are done with the visuals for your eyes, so I'll let your eyes rest. I'm going to check your ears now, okay? We're going to check the function. We're going to check the sensitivity. And we're going to do a bit of a cleaning if we need to, okay? Good. So. I have a tool here. It's called an otoscope. And what it has a little magnifying glass, so if someone were to use the light on it, you'd be able to see up close. I'm going to take a look into each of your ears. Is that okay? Good. I'm going to just do that and get to each side of you. Is that okay? Let me know if it's uncomfortable. So, first I'm just going to get to the side of your ears. I'm just going to put the otoscope into the ear, okay? And the other ear, okay? With both of your ears, I'm noticing that you have a bit of wax buildup, and if I may touch your ears. May I touch your ears? Thank you. There just appears to be a wax buildup that could be causing a bit of pressure onto your ears. Okay. And just going to do a hearing test. So, I'm going to do a bit of a hearing test on you. Is that okay? Yeah, good. So, I'm going to check for something that's called tinnitus. What that is it is a ringing in the ears, if you've ever experienced it. And a way that we do test it is by using a tuning fork. Sometimes the tuning fork can cause the tinnitus, as it has a very similar sound. But it's also a way to test your hearing, okay? I just want to know if you are able to hear the sounds, okay? So. going to show you this. We're also going to use this later, this tuning fork, as it's a good way to test your muscles. So, first we're going to test to see if you can hear it. And then I'm going to ask you a couple of questions, okay? Let's begin. And were you able to hear that? A little bit. Was it a bit uncomfortable? Okay. And are you experiencing any ringing of the ears? No. Perfect. You want to stay that way. Okay. I'm going to do it one more time, but get a bit closer to your face now, okay? Good. Here we go. And were you able to hear that? Okay. It was a bit more strong that time. That's what I thought. So, keep focus. Are you experiencing any tinnitus? And how about your balance? Okay. Good. Now for the hearing test part. I want you to let me know if the sound is coming from the right or the left side. Okay? So, what I'm going to do is I'm going to carefully just put my hands over your eyes, and you let me know if the sound is coming from the right or the left side. Okay? Perfect. So, just going to cover your field of vision. Let's begin. First one. And was that right or left? Good. Right or left? Good. Right or left? Good. Right or left? Good. And right or left? Very good. You did good. Are you experiencing any ringing in your ears or tinnitus? No. Good. That's a great step one. Now, as you experienced, as you said, a bit of sound tests, I'm now going to cover your eyes one more time. I'm going to just carefully put my gloves up to your ears to make a very quiet sound. And I want you to let me know if the sound is coming from the right or the left side, okay? Good. So the sounds, I'll make it a little bit louder so you can hear it now. A bit like that, okay? So let me know if it's coming from the right or the left. Good. Here we go. Right or left? Good. Right or left? Good. Right or left? Good. Right or left? Good. Very good. And now I'm going to put a bit of pressure behind your ears, okay? I'm going to be feeling for just a bit of sensitivity behind your ears. Is that okay? Good. Just going to just check behind your ears. And pressure or pain? That's good. Just making sure. Now, the last part of the exam is a muscular and skeletal exam for nerve sensation and sensitivity, okay? What that means is I'm going to be feeling for nerve reaction. And what this also means is it's a neurological exam. And what the cranial nerves do is particularly for your face and your whole entire body, but mostly the parts that you're able to do. I'm going to ask you different questions, different cognitive questions. I'm going to ask you to do some funny things, okay? What I'm going to ask you to do first is, with my hand, I want you to just touch my palm, and then I want you to touch your nose. I will follow through with you while you do so. So, touch the palm, and then touch the nose, okay? And let's begin. Ready? Your palm to your nose. Palm to your nose. Palm to your nose. Your palm to your nose. Good. Now from here, palm to nose. Palm to nose. Palm to nose. And then here, palm to nose. Palm to nose. And palm to nose. Good. What I want you to do now is put your hands out. I'm going to put pressure on them, and don't let me push your hands down, okay? Here we go. 3, 2, 1. Good. Now put your palms out, and I want you to close your eyes while keeping your chin up, okay? And I want you to keep your hands at the same level. So close your eyes, chin up, and make sure your face is chin up to the sky. Try to keep your palms at the same distance. Okay, do not raise them. Good. Now what I want you to do is take your hand, touch your ear. Good. And the other one, take your hand, touch your ear. Good. Take your hand and touch your opposite shoulder. Good. Take your hand and touch your opposite shoulder. Good. Now, this one's a bit funny. I'm going to ask you to take your head and just carefully let it try to turn to the direction of your shoulder. Okay, any difficulties with that? Okay. Now keep your head up straight and try to do that with the other shoulder. Any difficulties? Nope. Okay, and head up straight. Look at me. Good. Now. This is where we use the tuning fork again. I mentioned it prior. What I'm going to do is hit the tuning fork, and you let me know if you feel the vibration of the tuning fork on your skin. I have a difficulty with this just because I have had a lot of sports injuries, and there are some parts of my face I am unable to feel. So don't feel left alone if you're unable to feel it. Okay? I typically put them to the sides of the ears, the nose, the chin, and the lips, okay? Okay, let's begin. And can you feel that? on the nose. Can you feel that? Okay. On the chin. Can you feel that? And on the lips. Can you feel that? Good. Now, very carefully on the shoulders. Can you feel that? Okay, and can you feel that? Okay. Now, a quick muscular test, okay? I'm going to put my hands on different parts of your face and shoulders to feel for muscular strength, okay? I want you to mimic me. First, I would like it if you could raise your eyebrows very, very, very tall. Okay? So if you could raise your eyebrows as if you were very excited. Good. And don't let me push your eyebrows down. Very good. You can relax your eyebrows now. Now if you could close your eyes super duper tight. Just close your eyes super duper tight. Good. And do not allow me to open them. Good. Good. Very good. You can relax your eyes now. Now, if you could give me a very big cheesy smile. Good. And do not allow me to push your lips in. Good. You can relax the smile, don't worry. Now if you could clench your jaw very tight. Good. Good. Okay. Okay. Good. Next I'm going to put my hands right underneath your chin. And if you could swallow. Thank you. I know that's a bit difficult, especially when there's no beverage next to you. But thank you. Good. And next, could you shrug your shoulders and raise your shoulders really high? Okay. Do not allow me to push them down. Okay. And good. Good. And good. Very good. You can relax your shoulders now. Did great. And now, I can assure you your muscles are working fine. We have one more test. It is the olfactory sensory nerve test, which is your sense of smell and a bit of your sense of taste. Is that okay? Good. So, I have a lot of bottles that all look the same, but they have different oils in them with different smells. I want you to let me know what you think you smell. There are no incorrect answers, but I want you to get generally around the area of what you think you smell. Okay? And at the end, I'm going to give you an either sour or a sweet test, and you let me know if it is sour or sweet. Okay? Let's begin with bottle number 1. We've only got 5, so it's no big deal. And again, no answers are correct. Just let me know if you're unable to smell completely, okay? Good. So, it's going to shake that up a bit. Okay. And I'm just going to carefully put that close to your nose. And what is it that you smell? Okay. This is a very common smell. You might smell it all the time. Earthy. Okay, like the earth. What else? Like breakfast. So what does this smell to you? It's coffee. Very good. It smells amazing, by the way. Are you a fan of coffee? Some people prefer tea, some people prefer coffee, and some people prefer neither, and that's okay. On to the next. Okay, and this one. Okay, good. Oh, this one is lovely. Okay, and here is the second smell. What is it that you smell? Again, very common. It also reminds you of the morning. Very good, and it is very strong. Yes, it is. This one is mint. Very good. In fact, it's called Mint Dream. And I do have to ask you, did this smell give you a headache at all, or any sensitivity, nausea, vertigo? Okay. This one has a label here saying that it can cause a smell sensitivity. So I'm just asking you if you're okay. Good. On to the next. You're doing great. And this one, I love the smell. Okay. Oh, this one smells lovely. Okay. And what do you smell? It smells like fruit. Okay. Okay. Very good. This one smells like a lemon, like an orange. Yeah. It's a bit confusing sometimes in the essential oil department. Some of the smells can get confusing, especially after already smelling something so strong like mint. So this one is called Lemon Dream. And it smells like, kind of like an orange, kind of like a lemon, kind of like a, if you've ever had fresh pressed orange juice. Yeah, very good. You have 2 more left. You're doing great. Here we go. Okay. Ooh, this one's a bit strong as well. Okay. Here we go. And off the bat, yeah. It is a flower smell. Very good. This is a very familiar smell. Okay, any idea what kind of flower? Yes. This one is lavender. And as the other titles show, this one's called Lavender Dream. You're doing great. On to the last one. Okay, and okay. This one can get a bit difficult. Again, there's no right answer. I had a very difficult time trying to identify this one when I was presented to it, so don't worry. Mm-hmm. A bit like a forest. That's very good. A bit like wood. That's amazing. Are you able to identify that, or? Yeah. That's great. So this one is called Sandalwood Dream. I have been unfamiliar with this, but it smells like a spa, like wood. It's quite nice. You did amazing. And now I'm going to compile your results really quickly, okay? Yes, that was it. That was the cranial nerve exam. Are you feeling okay? Good. I'm just going to prepare the results. Okay. And what it appears is that you are in great health. With the results on my computer here, I'm going to send them to you so you have something to read in detail about every single cranial nerve. Now, specifically, the only thing I saw that could be something causing you a bit of stress or uncomfortability is a bit of wax buildup in your ears, and that's completely normal. Now, what I suggest for you is, if you can, clean your ears yourself. I'm going to prescribe a bit of an ear wax drop, which will help control the earwax and soften it. And I'm going to also send in a call for a little bit of ear wash. If that doesn't work, just come back in and I or another one of my colleagues can help you with your ears. Other than that, your cranial nerves are completely normal, just a normal and healthy amount of earwax. Okay? Yeah. So before you go, right at the entrance of the clinic, there is a pharmacy that will be to the left, if I'm not mistaken. And just ask with your name if there's something for you. There will be. And before you leave, I've already sent in your documents to be printed at the front desk. Just let them know your name, and they should be able to give you your documents so you can read about your cranial nerves as well. We have been tracking your heartbeat the entire time to see if there's something that could cause a stimulation, such as heart rate increase, blood pressure difference. And we're going to collaborate that data as quickly as we can using the connection between the device that should be on your finger. I'm going to remove it now. Is that okay? Okay. So just I'm just going to remove the device. Good. Perfect. Just going to. Good. And we're going to connect the data together and then send you the full detailed report in 1 to 2 business days, okay? Good. I highly suggest you read through the papers and see what you can, okay? If you have any questions about it, please call in, and I will be there as soon as I can to answer any of your questions, okay? Thank you so much. If you need another checkup, do not hesitate to call, and schedule an appointment, okay? I just hope you feel better. I hope you feel safe. And I do hope that this very detailed cranial nerve exam was something that you enjoy. Okay? Thank you for being here. I'm going to finish writing a bit of your report now so that you can pick it up. Good. Again, have a great rest of your evening.